This is what I was discussing in myths, debunking the myths.
Thank you, sir, for kickstarting our brain with a wonderful talk. We now request Chairperson Dr. Sunil Kumar to hand over a token of gratitude to our speaker. Thank you, sir.
We call upon our next speaker, Dr. Mohan Shanai, to talk on very commonly asked doubt, artificial sweeteners, current status.
I welcome Dr. Mohan T. Shanai for the next talk on artificial sweetener. So, Dr. Mohan Shanai is attached with Sri Gokulam Medical College and Research Foundation in Trivandrum, and he has multiple awards and papers and other contributions to the academics. Over to you, sir.
Thank you, dear Mangalore team, for having me here for a second time. So it's a great pleasure to speak in front of you and with my friends here. So this topic is very important because, as previous speakers have already alluded to, the concepts are evolving, and more often I think people are asking us questions directly or social media or some other way through our family or other friends. So this topic again will be trending or maybe important for us to a practical sense. So no conflicts to declare, though definitely the first word is artificial. I have not used AI for any of my slides. I have not used, but only I have got declared because I have lots of gratitude for my friends, Dr. Saumik Goswami, Dr. Umesh Kumar Garg, and so many other friends who have contributed to my knowledge. So this topic will be held by 4 different headings. How to get this classified and to understand realities of AS, I shall tell, artificial sweeteners. What are the metabolic aspects, benefits, risks, and the controversy, because we are fond of controversies. The most often watched program is debate on the TV. So that's what controversies are in. And lastly, what you should take home from the guidelines and recommendations. So definition wise, artificial sweeteners are a category which belong to the non-nutrition sweeteners. They are food additives or substances like sugar which add sweetness by adding few or low calories. The journey of artificial sweeteners began way back in 1879 when saccharin was discovered by Franberg in a laboratory by serendipity. When he was doing for another test, he discovered saccharin. It was sweet. Later on, it went on because World War I, that time sugar was rationed. They did not give sugar for the war front. Then they had to take artificial sweeteners, and then it popular. Then stevia came in, the sweetest substance, cyclamate, aspartame, acesulfame, sucralose, neotame, whatnot. There are many more things approved in the market. So as I told you, taste plays an important role in food quality. When you see the taste, by vision itself, you can see it is good. But later on, satisfaction, enjoyment depends on long term. Sugar substitutes existed way back also, but last several decades, because of the trend of the health coaches, the apps, and so many advertisements, and so many ads which are coming, we are all excited to use that. And obesity pandemic, they are using it because they think it will help them. So that is why we are discussing this topic. You can see here the circuits, olfaction, vision, gustation, gut sense. All are affected by the sweetness because sugar sense has neuroepithelial circuits, because by seeing the object gets the sense of pleasure. By tasting it initially, that taste gets built up by the sugar, the taste buds. Then you get gestational cells that are even going to the gut microbiome level also. That is the level in which the taste involves. So I told you a classification. They are also called NNS, and they differ because they are low calorie alternatives with little or no energy. The earlier generation, we had got natural sweeteners like xylitol, mannitol, sorbitol, and now they are now going out. This is the diagram which gives you a nutshell of the nutrients article, which mentions the role of taste receptors TR1 and TR3, how they interact with the beta cell of the pancreas as well, and the gut microbiota. So this is the complex diagram, but you can see the switching of, like Dr. Umesh had mentioned, the same metabolic switch like phenomenon occurs, where which the taste is generated, it programs, it is a learned behavior. The cognition keeps on programming and the person learns. This is the taste which, so how many of you use it daily? I don't think many of doctors use it. I want to just take a show of hands. Do any one of us use in our practice? But if you ask the patient, they will often tell they want to try. So next, coming to the approved, available, and realities. So this is how they classify the sweetness. So saccharin, most commonly sodium salt of organic acid, the first discovered one. It is not metabolized, it is excreted unchanged. Accepted intake is only 5 ADI. ADI is the time which we have mentioned in the standard textbooks. Stevia is a natural sweet which is very, very sweet, and it is excreted in urine as steviol and glucuronide. So it is 4 milligram equivalent is what acceptable. And relative sweetness, you can see it is very sweet, but it gives pleasure as well. Again, 0 calorie. You can see aspartame metabolized to amino acids and methanol. It is a bit difficult in that way. You can acceptable intake is 40 ADI, and you can see calorie is 4 calorie, which is very minimal as well. There is another modification called asulfame, just to see the comparison. It's the potassium salt of organic acid. Just like saccharin was there, they have got aspartame. Then you got sucralose, which is also used. So most of the preparations which are available in the market may be having any of this component. So I don't use any company names because I am not contacted or not, it's not a scientific talk only. So FSSAI has classified them as generally safe as GRAS, or generally recognized as safe. These are the 6 ones which is mentioned in the guidelines as saccharin, aspartame, asulfame, sucralose, neotame and stevia. So you can see this is very easy to remember. But updates are happening because people are experimenting. Chinese studies have found one sweet fruit, swingle fruit extract, which is actually getting recently approved by FDA also. And there are 2 more agents approved in global market which is coming up. So I think we have flooded with so many products already, medicines, but we will flood with more sweetness. So cyclamate and alitame are the 2 other names which may be again confusing for us. So how does this happen? This is not a simple diagram, but we can see everything in this diagram. These are molecules as I mentioned in the classification. This side, one side I have shown you that, and how they impair the glycemic response in diabetes, because it is personalized effect. And they are causally linked with the microbiome effect also, because it is a endo thing it's going in. So the eating behavior, energy metabolism, so many other responses are there, intestinal permeability. Long run, there are some studies, they may have some toxicity and some risks also, which I will tell in the last part. So duration is important because artificial sweeteners or artificial sweetened beverages are also available. So people think that they are also safe, but they have got an effect because they have endotoxins involved in that. And diet, we know the most common sweet is the natural sweet things. So they may consume again more of that thing, think that they are taking the sweetness. So that will add to the calorie as well. And as I have told you, the structure of the solution is also different. So biochemical pathways simplify this because there is a Randall cycle which competes between glucose and fatty acid for substrate. In long run, glycolysis also is important because it leads to lipogenesis. Because the person takes food and replaces the sugar that comes, the chain will disturb. So this is the last slide of this section which shows you that all these act through the pathways and channels and they go to systemic circulation and some may go unrestricted also. Now to the next controversy regarding metabolic aspects. So this beautiful journal which is just published about 1 month or 2 months back has given you a review. It is published from India, from Chennai authors have done in Frontiers in Nutrition. You can see here how this act, a simple diagram they have put. They act to insulin secretion pathway, glucose absorption pathway, gut microbiome pathway, and finally they affect the glucose homeostasis. But they are not very similar in each way. Individuals may different in the responses also. So I may appear like a person in the court arguing for artificial sweetness, but they are not like that. So that is why you should remember that this diagram depicts a satiety pathway, energy intake, energy expenditure, energy harvest, and finally adipogenesis. It is not very simple to, as previous diagram showed you. So what does the Endocrine Society all do? We do research meta-analysis. So existing research shows that beverages linked with or added with NNS have got no acute metabolic endocrine effect. They are similar to water also because they are actually like placebo or actually like water only, and they may just find support in acute postprandial settings only, like those having food, suddenly they want a lowering of glucose, not in the fasting situation it affects. It's only in the postprandial setting that got some effect. So that means that it should be used only in moderation, not in excess. What about children? Because I think long term, when they are in a child, they used to do it, and it actually programs their brain, pancreas and gut also, and maybe it can also affect the long term, which is not known. So this is the diagram which shows you ectopic fat deposition in long term when gut microbiota are exposed to the endotoxins related to these markers. So again, the data is again coming up within low calorie sweeteners diet and cardiometabolic health in young individuals type 2 diabetes. But today's study showed that 2 years of follow-up, energy intake was higher among those using low sugar substitutes. That means the same point, they may find solace in the other side. And again, people don't count the calories. That is why again, there is no evidence that non-nutritive sweetness will affect the appetite also. And the summary of this section is that they produce a counter effect of the metabolic derangements and definitely may be bad if you are using without monitoring. Now coming to the evidence and recommendations. So again, this review which I had shown you previously gives you a summary of everything, artificial and natural sweeteners, what are the advantages, the disadvantages. But remember that artificial sweeteners definitely have got advantage because dental side it is good because the flavor, the GLP-2 activity, not GLP-1, GLP-2 activity for the dental side, it is good. And there are shown some studies of increasing risk of so much metabolic like cancer, hyperglycemia, which I will show you some data meta-analysis. So there are Cochrane review because we say that after one study we get published case report, then case study, then goes up to cohort study, then goes to above. So above meta-analysis we have got Cochrane review studies. So in that they combine 9 RCTs which about 979 patients with type 2 diabetes or type 1 and followed them for about 4 to 10 months period. And you can see some studies were done on different agents. This is the combination of different agents shown here. So they are showing like similar HbA1c and weight as the other agent. So there is nothing like they cause a better than the other agent. And 3 trials showed similar non-serious adverse effect. What we have shown is coming up. And some data is not there on the quality of life, diabetes complications, mortality and socioeconomic, which we want to know actually. So definitely it's coming to a low certainty evidence. That is why we should do a real world comparison. So this real world study done in American Journal shows you a comparison of sucrose, aspartame, saccharin, sucralose and other agent available there and found a comparison with the standard preparation and significantly increased the body weight compared to the other agents. So sucrose and saccharin have this earlier generation. And glucose tolerance was not affected by any of the sweet. That means it is not having any cardiac or glucose neutral effect. So again, body weight reduction, the studies, again, they have done a meta-analysis, pooled data, which shows you that some studies may have got increased BMI, but some have an inconsistent value, but definitely no reduction of body weight by using these things. I told you about dental health because oral bacteria metabolize glucose to acids. They demineralize the enamel and dentine because if you use excess sugar, that can damage the dentine, we know that. But NNS definitely are not metabolized by these acids. That is why they may prevent caries. That is why most often, even if we don't start, dentists may start these things. And they influence the gut microbiota composition also. That means that data is also shown in vitro and systematic review that they have got definitely antimicrobial activity against the common periodontal pathogens, not the other pathogens. There is the aspartame, saccharin and sucralose. So now controversy regarding the cardiovascular risk. There is one study from French adults, large-scale prospective study. The study name is also here, NutriNet Casante cohort, that showed that is having an increased risk of cardiovascular, cerebrovascular, coronary artery disease. WHO saw this and then rang the alarm bell in 2020. That is why we got to know more about this and also observed some amount of higher risk of diabetes also with these artificial sweeteners like these agents. But again, we have to go for the real data and diabetes care examined this data and again they gave a like Supreme Court goes, they go there, they get a bail. Like that, they found not also with cardiovascular harm, no issues with that. But definitely they are just like standard care of like water also they can be used. They cannot be used ad libitum, they can use in moderation. This is the data set which I have shown you. It is like 2 studies were showing favoring the SSBs and 2 studies were showing favoring low nutritional substitutes. So this is the last study which I have published. So this is the Nutrients 2023 showing you by visit there are different agents used, non-sweeteners, sugar sweetener, beverage and water. So this is called Stop Sugars Now study. So this study done even the optional, the MRS scan, the questionnaires were done, the weight 3-day record were done, the beverage log was done. This is a comprehensive data set comparing these 3 available things, non-nutritional sweeteners and sugar beverages also. That shows that it is actually water and all are almost similar to this. So now just busting the myths regarding and cancers also. they are telling was cancer, but again, the fact shows that US FDA had done a real data, even they checked the data, showed that American Cancer Society, so that it's all appear to be safe when consumed in moderation. There is no increased risk, though aspartame, they mentioned that there was a risk in the mice model. Again, CKD, National Kidney Federation, the KidGo and all, they endorse it using as a pan of emergency diet plan, not for the routine diet control. So this is the WHO data which I had shown you, that long-term risk had been cautioned, and they mentioned not to use it for achieving weight gain or weight loss or anything. And this is the last one, ADA 2024, mentioning in standards of care, it is GARS recognized to be safe when used in acceptable quantities, and definitely they mentioned in a word that it is facilitating positive health outcomes only, not in a long term. This is the guidance which I have shown. So I think I have not confused you much, though I think I was also trying to learn much. So you can see that so many data sets have come, so many data sets will come, and maybe next speaker, some other later on will tell it's better. So I think we had to just go through data, examine the data, and then analyze it ourselves and use it in our patients. And definitely there you be used in a very caution and precaution manner. Communication, guidance, and moderation is the key. And you remember the book published, John Woodkin mentions that sugar is killing us and what we can do to stop it. And it is a big market outside. So you can see saccharine, they are all growing by leaps and bounds from the last several years, and it is going to take up more. As I told you, so many molecules are going to come up. And you can see India is going the global burden of diabetes also. So the last decision is yours only. I am not just giving you reports. So this is the last slide. The doctor said to use less of finally had to give you medicines to stop the. So this is what finally the conclusion lies. So I invite you to the ENDOCON also, which is going to happen very soon in Calicut. And we are also having a pediatric endocrinology symposium, which I will be also having a session. So any one of you interested, please let us know. Thank you.
Thank you, sir. Dais is now open for discussion.
I think 4 minutes are given. Yeah.
Sir, any role of behavior modification or not to seek sugars or something against the artificial sweetness?
That's what sir, I mentioned. Positive outcome behavior is what required. So whenever they start this agent, they don't know how much to take. The bowl size, 2-3 they will put together. So one is enough for usually they say, but they will not stop at one. They will tell, okay, I want to taste it more. So there is no standard cutoff for this, but they have mentioned we have to very bit behavioral modification for any disease is much important, and artificial sweeteners are almost like that is the most important thing. Remember that they can keep many stocks, so don't forget to tell them that they may also land up in issues later on.
What about dates? Many people use that as a kind of
again, that is again
so glycemic index.
Yeah, so we have also having people who bring some date syrups, because in Kerala we have some people bring lion date or some other dates. So again, we can use it in our peanut butter. People ask us peanut butter also. So these are all approved, like you can use as a healthy outcomes, but no doctor can endorse like it's better than best. You can use it as far as you know, and whatever potassium it can go increase. So that is what, don't take more of any fruits. So any 1 or 2 is enough, but not more than that.
Just for my understanding, the daily prescription, can we give this saccharine for morning coffee, evening tea, and one
that's what because on prescription wise, I think dentist will tell for dental care. Yeah,
in case the patient asks.
We can definitely tell them. Data is good.
2 to 3 servings.
Yes,
in a day.
They generally recognized as safe only. They are not like told to be not used. They can be used for health benefits, not for the what you call robust outcome.
That long duration means how long they can continue?
That is the patient's behavior till they feel better. So taste is one subject. I think we can think people want to taste, but I think people subjected to different preparation. Those in the Gulf or somewhere, they cannot take medicines. So they take this and go, and they experiment with all these which I had shown you. Newer medicines are also approved. China is flooding them with so many molecules. So I think they should experiment and know what is best for them. And as a doctor, we should tell them these are all as safe only, but we cannot endorse them outcome.
When you take the artificial sweetness, the crave for taking the sugar increases. That's what.
Yes, they have mentioned there. Yeah.
Yeah. So
that is what appetite signals are triggered, but long term they balance it out. They
What
just
is
used
its
to.
effect on the gut microbe and the
Yeah,
body?
so that is what endotoxins, LPS, there is a signal pathway, and the brain, hypothalamus, pituitary, there is a channel going there. So this circuit may be affected by the endotoxemia. So what happens is low grade inflammation is there in obesity, diabetes, and other conditions. You can HSCRP we are doing. So that inflammation can be uncovered sometimes in long run if you are using these medicines. That is why endotoxemia can be. Sir.
Any effect on artificial dentures, not natural teeth?
Very good question. So I don't have an answer. That is what natural teeth definitely periodontitis and all. Artificial teeth, this all we can remove and keep. But definitely that has got a effect on the bacterial flora also. But I may not be the best person to answer. Dentists will be telling. Good question. Anyway, everything is artificial there. To sweetness are also artificial. Taste is also artificial.
Thank you, sir. We now request our chairperson, Dr. Sudhindra Rao, to hand over token of gratitude to our speaker.
Our next speaker, Dr. Vagesh Iyer, will connect to us via recorded session on a topic, giving fitness in a diabetic patient for surgery. Since this is a pre-recorded session, there will be no Q&A. Thank you.